This is a video in clinical medicine from the New England Journal of Medicine.
This video will demonstrate the placement of the laryngeal mask airway, or LMA, as an emergency airway device in patients experiencing a cardiopulmonary arrest. The goal is to provide familiarity with and instruction in its use so that a clinician will be comfortable using this device to provide effective ventilation for patients in cardiopulmonary arrest. Instruction beyond this video is necessary for safe and effective placement of a laryngeal mask airway, and the clinician should seek further training from anesthesiologists or others who have expertise in its use. The laryngeal mask airway is a device used routinely by anesthesiologists for surgical operations. Its use should also be strongly considered for ventilation in pre-hospital and in-hospital cardiac arrests. Both the American Heart Association and the European Resuscitation Council consider the laryngeal mask airway an acceptable device for use by non-experts in tracheal intubation when performing emergency airway management. The laryngeal mask airway is also an important rescue device in situations where tracheal intubation is impossible or has failed, and in situations where access to the head or positioning for intubation is not possible. Use of laryngeal mask airway instead of bag and mask ventilation during CPR has also led to fewer events of pulmonary aspiration during resuscitation. The reasons for laryngeal mask airway placement during CPR are many and include high first-time success rates, rapid placement by both novices and experts, necessitating minimal disruption, if any, of chest compressions, ease of ventilation during prolonged resuscitations, as compared with bag and mask ventilation. It is a good option over placing an endotracheal tube when tracheal intubation is difficult or has failed, and placement can be achieved without head movement in patients with potential instability of the cervical spine, for example in patients with traumatic injuries or rheumatoid arthritis. An adult-sized laryngeal mask airway is a flexible breathing tube of approximately 25 centimeters in length with an inflatable bladder or cuff on its distal end. The proximal end has a standard 15 millimeter connector that allows attachment to any ventilation system. Air exchange occurs through the aperture on the distal end of the tube. This illustration shows the identity and location of the tongue, hard palate, epiglottis, esophagus, and laryngeal inlet. Review of these structures is helpful for understanding proper placement and potential difficulties. Unlike oral airways and nasal airways, the laryngeal mask